Good morning, ladies and gentlemen of the media. It's my pleasure to be here this morning. As you can see, I just conducted a tour of the Civil Defense Commission facilities as it relates to the fact that they were distributing care packages to persons in our society who are affected by the COVID-19 virus. The Civil Defense Commission, I believe from the outset, must be commended for the work which they have done. I want also to commend those entities who have contributed to the work that the Civil Defense Commission is doing and who have actually made donations of supplies to the Civil Defense Commission to assist the needy and vulnerable at this time of a crisis. However, we need to understand a couple of things, and that is that the Civil Defense Commission is a commission that responds to an emergency. Invariably, those emergencies are of a short-term basis. And so maybe immediately after a flood, after a fire, or some national disaster, the CDC will go and they will make an analysis, an assessment of what is needed, and they will respond. This situation is a little different because it is likely to be not of an immediate impact situation, but a long-term matter. From all of the assessments I am seeing, it would appear as if we will be subjected to the coronavirus restrictions going into 2021. There are some countries that have actually projected that it will go up to 2022. But our situation here in Guyana is that we have issued instructions, we have issued guidelines for emergency measures with respect to COVID. And in the first instance, those measures cover up to the 5th of May, 2020. However, it seems from when I'm looking at the figures now that the curve is still going in an upward direction, and therefore we have to ensure that we take those measures that are necessary to flatten the curve. When we compare ourselves with countries in this region, it seems as if we are moving in the wrong direction. And so I want to appeal to all Guyanese to heed the instructions given with respect to social distances, with respect to staying at home and working from home, and unless it is absolutely necessary that you be on the road, that you stay at home. This is the way in which we will be able to deal with this virus. At a second level, there is a curfew which is in place from 6 p.m. to 6 a.m. And I'm encouraging Guyanese again to observe the conditions of that curfew. Only persons who are described as essential are required to be on the road during curfew hours. And so while we are still using what I will call a soft cell approach, I believe we are coming to the time where we'll have to be strong on the enforcement measures with respect to the curfew. This coronavirus is not a joke, and some people still are of this view that it is not going to affect them. The numbers are clear, my dear friends. Many of you have brothers and sisters and relatives in the United States of America and in other parts of the world who have died from this virus. And many homes in this country are in mourning because they are unable to attend even the funeral of their loved ones. So do not let us take this as a joke. This is a very serious matter. And I think as serious Guyanese that we have to take all of the necessary precautions to ensure that we do not continue with that curve going upwards and upwards as I'm seeing it now. So as a matter of urgency, The national task force that has been commissioned to deal with the coronavirus, which is chaired by the Prime Minister, met yesterday and made certain decisions. Some of those decisions relate to the way in which we deal with the distribution of hampers for care packaging. We took the view that this was going to be a long-term matter, and therefore a one-time distribution of items to some communities would not suffice. Because in the long run, somebody who receives a package in April most likely will be looking to receive a package in May, in June, in July, and you go on like that. So that as a government, we have thought it necessary to look at this matter in a strategic and in a long-term way. And therefore, what we've asked is that the distribution of hampers in the way it was going, that we put a pause on that. That those items which are here now, that is, I believe there are about 3,000 items or so, that we will allow those to be distributed under some new guidelines. But going forward, we will have to ensure that we put in place some different systems. And what I'm talking about is a system that identifies who are the vulnerable in our society. In the past, we have used certain lists to determine who are the persons that are vulnerable. But in this pandemic, we have a situation in which people who were not vulnerable before the pandemic, but has become vulnerable now. For example, there are persons who have lost their livelihood because of the restrictions on persons assembling. Persons who have been dismissed from their jobs. Persons who are at home and cannot move. And so what we have to do, we are putting in place arrangements now that will A, facilitate distribution of items, and B, facilitate the distribution of checks or food vouchers to allow for those persons to benefit from it. What we are doing now, we are setting up, in fact we have set up a database which will allow for persons who are affected to register on that database to say, look, I am a vulnerable person, I have been unemployed, and therefore I am requesting assistance. Once that is done, the Ministry of Social Protection will do a check on those applications. And once we are satisfied that those are persons who are vulnerable and who satisfy those requirements, then we will make a determination as to who gets a care package or who gets a voucher for them to go and actually buy these foodstuffs at various places. So we are open to employ a more scientific basis for the distribution, as we believe it is going to be for a longer period, and therefore what we have to do now is to increase the capacity of the Civil Defense Commission to be able to manage an operation that is for a longer period and is across the country for all the citizens of Guyana. So insofar as the operation is concerned this morning, I want to thank the CDC for providing me with this opportunity. I want to say also, and put out a word to those companies that are actually producing sanitation equipment, those small producers who are producing masks and things like that, that we want to encourage you. We want to encourage this level of business by small people, by medium people, and by large companies that will deal with this situation in a very serious way. So I want to congratulate those large companies who have ramped up their production in disinfectants and cleaners and so on for our communities, for our houses, for our hospitals, and for our businesses, and basically for home use. I know that there are many of you out there who are doing things, and I invite you to get on to the CDC to say to them, look, I am doing this, this is what I am doing. And I would like to be part of this effort. In many cases, once there's a cost involved, we will try to ensure that we're able to pay you at least some part of what you would have expended. But the bulk of what we're seeing is basically people who are doing this from the bottom of their hearts because they believe that this is their contribution to helping Guyana to flatten that curve and to ensure that the coronavirus does not take us all down. So to those persons who have already contributed, and those seamstress and tailor shops, people who are there watching this program, and who are wanting to do things, I want to encourage you to continue to do that. At this season, at this time, we have to show love, we have to show care, we have to show compassion to all our Guyanese brothers and sisters. And finally, I make this call for all other organizations, be they political or otherwise, to recognize that this is a national effort and that I call upon you to get in tune with the national effort so that our efforts are not stymied and go in different directions, and so that one set of persons get the benefit of what is coming from the nation twice, and another set of persons get nothing. So I would just want to say those words, and I want to thank you, Colonel Craig, for the work which you and your team have done and continue to do under very trying circumstances. I know that the CDC, this is not the only work which you do, because you still have to be on the lookout for any other emergencies which will arise. For example, the overtopping of a sea defense or some major fire, some major disaster. You still have to prepare for that, and you still have to be able to respond to it. So that this in itself is, I know it's a major drain on your resources, but this is necessary. This is necessary, and this is what we believe as a government. We want to, as I said, strengthen your capacity to be able to handle this aspect of your operation while you can continue on a normal basis. Yes.
They are asking to clarify the work of the CDC, considering the populists have the impression that the entire country, the entire nation will benefit from the distribution of hampers, and not just vulnerable communities.
Well, as I said, we had to make that definition clear. The CDC is a member of the National Task Force. The CDC, insofar as its structure is concerned, they have what is known as a national platform for disaster management. And on that national platform sits persons in government, persons in the private sector, persons in international organizations in this country, persons like the Red Cross and organizations like that. So there's that national platform that determines policy. But at the operational level, the Civil Defense Commission and the executive officers in the Civil Defense Commission basically executes those tasks of ensuring that in a disaster, in an emergency, that persons can receive assistance as fast as possible and in an equitable manner. But as I said, this is not a one-time arrangement, and therefore the capacity of the Civil Defense Commission to undertake it is severely challenged, and therefore we will have to bring in from government and from the private sector and so on additional resources to be able to ensure that the distribution in whatever form it takes is equitable, it meets to the persons who need to get it, and it does so in good time.
Second question, DG. I know private companies are assisting CDC with some donations. What's the response been like?
Well, I have spoken to Colonel Craig about that. He has said that the response is good, and we want to encourage them to continue to do so. We believe that it can be better, but in this is, as I said, this is a different period. It's not as if this is just a seawall broken or something has happened, like a disaster or a hurricane or something that we are trying to respond to in some other country. This is a situation which is going to have long-term impact. It's going to have impact on small business. It's going to have impact on big business. And so all of these are matters which we are considering at the level of the task force so that, when this virus is going on, we still have to have a productive capacity to be able to provide these food and so on that you're seeing here. And so it is having a total look at all of the available resources in the nation, in the state, that we'd have to put to the efforts that are taking place here.
And my final question to you, DG, is there's a Republic Bank account set up for monetary donations. Would you be at liberty to say how much money has been donated so far?
I cannot say, as I said to you, this is my first engagement with the Civil Defense Commission since the meeting of the task force. And I'm sure Colonel Craig will be able to provide that answer for you. What I can say is that the accounts which have been set up by the Civil Defense Commission for this purpose, those will be the accounts which we will continue to use going forward. We'll ensure that they are properly audited statements of the accounts, and therefore it will be transparent in the way funds are put into the account and the way funds are taken out of the account.
Thank you.
To Lord DPI, this is a continuation of some questions sent in from members of media. What other interventions are being undertaken recently by the task force besides a revamp of the way going forward with the distribution of hampers?
Well, as I said, we are looking at the way in which small businesses are affected and the manner in which we can assist those small businesses that are affected. We are looking at the manner in which these packages or this help actually get to some people, and therefore we may have to involve the Ministry of Public Telecommunication with respect to the use of post offices and things like that. As I said to you earlier, we are also looking at the preparation of vouchers so that the logistic tail from the decision making until to the point where the person actually gets it, that can be reduced, because all you may have to do is to send a check or send a voucher, and that person now has the ability to be able to cash that voucher at a place which has been assigned.
And secondly, His Excellency in a recent address spoke about the need for unprecedented spending to deal with the pandemic. Can you say how much money the government would have expended so far to deal with the situation, and how much more is projected to be spent?
Well, these are still early days, and therefore what you are getting are submissions that are being made to the Ministry of Finance. Those submissions have to be properly costed, they have to be analyzed before any sums of money are allocated for that purpose. I think the point that His Excellency was making is that we will not spare any effort to ensure that the health of our people remains and retains and gets the priority which it deserves. I think that is the point he was making.
And still on money, I know we still have to work towards getting a full cost, but as it relates to the setting up of isolation facilities and quarantine facilities that have already been done at those being undertaken, for example, at Oval,
Yes.
where the former hotel is, Ocean View, has there been a cost attached to that as yet?
What I can say about that is that the Ocean View Hotel is being refitted to be a COVID hospital. What that means, it is in some cases, I think some persons call it a sanatorium, but is in fact a place where you will have all of the facilities with respect to COVID being dealt with in one place. In some countries, they have converted national tennis centers, they've converted gymnasiums, they've converted hotels, they've converted all sorts of places to deal with this matter. In Guyana, we are a small country. Our resource base is very small. And publicly, I believe that the Ministry of Public Health will have already spoken about the consideration for uses like place of the gymnasium, the National Gymnasium, and so on. But the facility at Ocean View, I believe, will be the first in the entire Caribbean where we are dedicating a service, a facility to this matter. And going forward, we will not have pandemics, we may have epidemics and so on, but going forward, that is going to be a facility for this purpose. So I think that is something that we should embrace and embrace in a very positive way. I believe that work has already started on the facility because it is not something that we can waste time about. And so that is an important aspect of the fight against this pandemic and the way in which government is responding to it.
And a follow-up on the theme of Ocean View, or former Ocean View Hotel. Can you say what's the arrangement between the owners and the government who is funding the rehabilitation? And has it been taken into consideration that this facility is known to flood from overtopping?
I am given that understanding that, but that there has been some work already done in that area where sea defense is concerned, and I don't recall recently where there's been any flooding. But in any event, the engineers and the geotechnical engineers would have taken that into consideration. I believe that the work has started, and it's work that is going on in earnest. And I think that at the end of it, in a very short space of time, we will have an A1 facility where we can be able to say to the world that this is what we are doing for Guyanese who are affected by this COVID virus.
And the cost attached for that?
I cannot say specifically what is the cost right now, but what I do know is that the present person who is in possession and occupation of the building has allowed for us to start working, I believe, even before any formal contracts have been signed. And so that the financial arrangements are still being worked out, but because it is a matter of national urgency, I think that facility was made available to the Ministry of Public Health.
And of course, it was indicated that it can be used for the long term.
For the long term, yes.
And lastly, Guyanese have been saying that APN and AFC officials have not been visible on the ground since the elections and during the COVID-19 in comparison to opposition officials. What are your thoughts on this?
Well, we have put out instructions about social distancing, and if we put out those instructions, then we should follow them. The other persons who are, in my view, trying to score political points recognize that there is an inherent danger in what they are doing. And therefore, we have to always ensure that once we put out rules, we put out regulations, that we live by them. And to the extent to which government officials are able to interact, we have been interacting and we will continue to interact with the public. The public understands that this is a very serious time and that all that we are doing is for their interest and for their benefit. So that the fact that we have not gone out on large meetings and so on, it is because the restrictions are there. And it makes no sense you putting in place these restrictions and you are the ones to be seen breaking it. So that is what I would like to say on that point.
DT, we've had some questions coming in from other sections of the media, and this is off the topic. Some persons would like to know, or would like you to respond to the opposition's claim that the government is using taxpayers' monies to pay for a lobbying firm in the U.S. to protect its image from the last general and regional elections that was held.
Let me comment on that by saying this, that at my last press conference, I made it clear that there was a narrative against which we were dealing with in this country. It's a narrative, it was a false narrative that had been created by the PPP and perpetuated by a company which they retained in the United States for that purpose. And that narrative was making its rounds all across the world in world capitals. And that we believed as a government, it was our duty, our responsibility to ensure that our narrative, the facts as they occurred, should be placed there in these capitals. And therefore, we felt it was necessary to have a company that has that access to be able to put out our side of the story. What you are seeing circulating now as a dossier that was circulated was a dossier that was prepared some time ago. That dossier, we had circulated a dossier to the heads of CARICOM when they were here. The prime ministers of CARICOM, they were given copies of that dossier. It was circulated to other places. But it is now getting traction because of where it is coming from. And so I say that this has now caught the attention of everybody, not so much as the content of it, but from where it is coming. And I believe that as a country, as a government, we have a right to ensure that the developments which have taken place in this country, that they ought not to be derailed by virtue of a narrative which goes out there that is contrary to the facts of what is happening here in Guyana.
So follow up to that then, could you say how much the firm is being paid?
I would say to you that this is not funds that have been from the government. We have supporters around the world who are very incensed, who are upset that this kind of narrative continues to be perpetuated on a daily basis, and have come forward to say, look, what can we do to help? And our supporters and friends abroad have come together, put together the little $100, $2,000 and things like that, and they are paying for this. No money has come from the government treasury.
And lastly, there are some reports that Mr. Carl Greenwich has been fired by the government, or rather the president. Could you say if this is true, if he has resigned or he was terminated?
Let me make this clear again, because I think I answered this question at my last press conference. That Mr. Greenwich was not terminated, neither was Mr. Greenwich fired. What has happened is that after every election, the president has to make a determination as to what his cabinet would look like, who will be his ministers. And in that way, what he has to do is to bring to an end the engagement of all of those persons, be you an advisor, be you a minister, and so on. And so that is what you call cleaning the slate. And thereafter, the person is invited to meet with the president to say, this is my proposal and let us discuss it. So that is the stage where we are with some of the letters that have gone off. My understanding is that the letters were prepared for everybody, but that because of all of the situation which occurred after with the Council Region 4 and so on, that the president was not able to complete sending off to all of the persons who are affected. But certainly this has been no attempt to single out the persons who have received letters. It was a general procedural matter, after which there will be a discussion as to where you're going to go next.
Thank you very much,
Right.
DG. Thank you, ladies and
Thank you very
gentlemen.
much.